Hi everyone, Andy here. I hope you're doing great. I also hope you're doing some good. Today we're here with Melissa Baum. She's a registered dental hygienist, and she's going to give us the ins and outs of becoming a dental hygienist, what it takes, the ups and downs, and the challenging, and we are starting right now.
What the public thinks dental hygienists do is we clean teeth, which is basically like we just brush your teeth and lecture you about brushing or flossing or what you're not doing correctly. When actually we are an oral health clinician as well as an educator. We're a very important part of the dental team. We actually take x-rays or radiographs of the teeth and the gums, and we check for periodontal disease, which is making sure that you don't have a disease that's causing destruction of your ligaments and the bone that support your teeth. We are looking to see if you have any vitamin deficiencies. We're helping and assisting the dentist to make sure we don't see any abnormalities with your tissue that could be possibly oral cancer. We do a lot of different things as a dental hygienist, more than just cleaning teeth. We're a very important part to the dental team, and we work really closely with the doctor, the dentist, and his assistants and the front desk team to look out for everyone's oral health. A lot of the highlights in my profession that I really love, I love relationships with my patients, and after I've been a hygienist for 20 years. So for me, I love how when I've been with a family and I've watched them grow up, to me I really like to know what's going on in their lives, not just, what we're doing in that appointment. I really have loved those patients where I'm doing a periodontal therapy, which is where we're cleaning out some of this infection and disease, watching the healing process with that, and then from where we start with the gums and the teeth, then it moves over to the dentist, and they're doing great cosmetic work for this dentist or for the patient. So when it becomes they were afraid to smile, or they were unhappy with their smile and they would never smile and always keep their lips over their teeth, then they were very proud to show off their smile, and just seeing someone be happy and feel confident. Smiles are the first thing that people notice on someone, and when they have that confidence to smile and to know that you were some part of that, that means a lot. And for those patients that when they first started coming in to see us and they were very fearful and very afraid, and maybe they had a past experience when they were younger, whatever the reason may be, they felt comfortable coming in over time, and they got over those dental fears, and knowing that I was part of that and helping them feel more comfortable in the dental office. Because one thing that people don't realize is when they say, oh, I don't like to go to the dentist, I'm fearful of going to the dentist. Dentists are some of the most caring people that you will ever meet, and so are the people that are on their team. So that's one thing that sometimes the public doesn't realize. They're actually super caring about all of their patients. Challenges as a dental hygienist is when you are trying to educate a patient on their periodontal health and maybe some concerns you have, and they're so fearful of being at the dentist that they're not really hearing that this is a team effort, and they might only see me once every 3 to 6 months, but what they do at home is a very important part of this team effort to get their oral health in check. That can be a big challenge for a dental hygienist. The type of person that would be really great in a career in dentistry, especially dental hygiene, is an extrovert for sure. If you are an introvert, this is not going to be a happy career for you. You have to deal with a team of people that you work with. You have to talk to patients. You have to make them feel comfortable. You have to do education. And if you're introverted, you are not going to feel comfortable in this type of environment. You also have to be a very caring person and empathetic. You need to be a good listener because patients come in and they a lot of times want to talk about more than what's just going on in their mouth. You're treating more of the body than just this aspect, and if you aren't a good listener and you're not a caring person and you're not extroverted and like to talk to people, it would be a little more difficult. To not do well in dental hygiene, you'd have to be a person that doesn't like the sight of blood. There is blood involved in dental hygiene. When you have infection in the gum tissue, you're treating that. You're cleaning under the gum tissue. It's beyond what you see just above the gum line. There's a lot of blood involved for those patients that have any infection. Anyone that doesn't like saliva, working with people, being up close to someone in their mouth. A lot of people, if you don't find that a comfort zone for you, then dentistry at all, especially dental hygiene, probably wouldn't be a great fit. My day would start where I would go into the office and I would work with the dental assistants to kind of get our rooms set up. I'm usually responsible for my own operatory, my own chair, making sure all my instruments and my tray is set up with all the instruments that I need to clean teeth. Any ultrasonic device that I use, which is a machine that uses water, make sure everything's set up. I want to make sure that my, what they call an armamentarium, is all set with everything I'm going to need for that appointment. So there's a lot of prep time. In dentistry, we're all about universal precautions. Everything is really clean, everything's been sterilized. We are over the top about it. So we just make sure everything's already ready, set to go. All the barriers have already usually been done the night before, but we go through and redo things for that morning. Normally a dental hygienist will see, in a regular setting, 7 to 8 patients a day. I prefer to have an hour per patient. That allows me to take any checkup x-rays that are needed, allow me to go over medical history, take a blood pressure on my patient, because you do take blood pressures as a dental hygienist. We usually get a lunch time of about an hour, and sometimes we go as a team, other times we do our own thing, and then we'll finish the afternoon, and at the end of the day, we will run lines, run things through the suction, everything's clean, sterilized. So some of it is the same every day, but the types of treatments that you do as a dental hygienist can vary. You could be seeing a child for their appointment time to an adult, so it just depends on what everyone needs. But that's pretty much the day of a dental hygienist. It's busy. When I went to school, you had to do 2 years of prerequisites. You took most of those courses with nurses. I had some physical therapists, different types that were in allied health. You were going to a health career. You take all of your anatomy, biology, physiology, all those prerequisite courses in 2 years, and then you start to apply to your school. And where I went to Indiana University School of Dentistry. Your hygiene program had to be in a dental school. It's not that way here in California. So in California, they have different programs that have evolved that you can actually go to. Some of these junior colleges now offer a dental hygiene program. So things have changed a little bit since I went to school, but you definitely, it's beyond high school. You have to have either a Bachelor of Science in Dental Hygiene or an Associate of Science in Dental Hygiene. Most dental hygienists that graduate right now start at about $45 an hour. And if you've been in the field for a while, it's not unexpected to see $50. There are those higher positions that you might be able to find that are over $60 an hour, but the most range you'll find easily is the $45 to $50 an hour range. But in Southern California, a lot of dentists hire dental hygienists as part-time. That's something that's very appealing to dental hygienists, is they have flexibility and they can work part-time or full-time. But most hygienists work part-time in Southern California, which means as a part-timer, as you start working, you'll realize, oh, I might make $50 an hour, but now I have to think, I have medical insurance to pay for, and I have to, think about, how many days am I going to work to afford my lifestyle? Do I have student loans? All of those things are something to think about if you're working in Southern California.